Because of the similarities between Paget's disease and eczema, chronic inflammatory skin condition, left bracket dry skin, red patches with an itchy sensation, right bracket, or even psoriasis patches of raised skin, left bracket often red in color, right bracket, with thick silvery scales. Most doctors will refer their patients to a specialist for correct diagnosis. Diagnosis of Paget's disease may include the following. 1. Mammogram breast X-ray picture is used to check for breast cancer in a woman where the following apply. There are two types. A screening, when no signs or symptoms are apparent. Or B. Diagnostic, when certain signs or symptoms may be apparent, lumps, sores, or a general cause for concern. 2. Ultrasound scan, which uses high-frequency sound waves to produce an image of the breast tissue. 3. Biopsy is usually undertaken when either of the previous mentioned diagnostic measures have concluded that an underlying problem exists. It usually consists of a small amount of tissue being removed for examination under a microscope. However, this type of biopsy will depend on the symptoms, which may include a nipple scrape biopsy, where cells from the epidermis, the surface layer of the skin, are removed from the affected area. B. Punch biopsy, where a small circle of tissue is removed from either the nipple or the areola, the darker skin, left bracket circle, right bracket, around the nipple. C. Core biopsy, where a small tissue sample is removed from the area of concern within the breast, usually where some suspected problem can be felt. T. Image-guided biopsy, where a problem is suspected but cannot be felt, usually used as part of the mammogram or with an ultrasound scan. Once diagnosis has been confirmed, a treatment plan will be offered. Although any treatment plan will depend largely on what was found during the biopsy. Treatment of Paget's disease may include the following. 1. Surgery, breast conserving surgery, wide local excision, or lumpectomy is usually the first recommendation for Paget's disease, where cancer tissue will be removed. Usually this type of surgery will include removal of the nipple and the areola, or a mastectomy, where cancer tissue will be removed together with the nipple. However, depending on what was found during the diagnosis, the extent of metastasis, left bracket, spread of cancer, right bracket, and expected result of cosmetic surgery, left bracket, breast reconstruction, right bracket, after surgery, a patient may be given the choice between the two types of surgery, breast conserving or mastectomy. Breast reconstruction can usually be carried out at the same time as the mastectomy, immediate or delayed during the following months or years. Another type of surgery that may be carried out is lymph node removal, where invasive breast cancer lymph glands in the axilla, left bracket, under the arms, right bracket, are cancerous, has been diagnosed along with Paget's disease. However, this type of operation is usually only carried out after previous mentioned surgeries, breast conserving or mastectomy, but before delayed breast reconstruction. Surgery is categorized into two different types. A lymph node sample, left bracket, biopsy, right bracket, where only part of the lymph nodes are removed. Or B. Lymph node clearance, where all of the lymph nodes are removed. Lymph node biopsy, left bracket, sentinel, right bracket, a procedure where tissue is removed from the lymph nodes closest to the existing site of infection, cancer, or other disease, is widely used where previous tests show no indication of cancerous cells. It usually identifies if the lymph nodes are cancerous or not and whether lymph node clearance surgery will be needed. However, if previous tests have indicated the lymph nodes to be cancerous, a lymph node biopsy is not suitable. Rather, a lymph node clearance operation will be recommended. It is also important to note that if cancerous cells of the lymph nodes have been diagnosed, although they have not yet developed the ability to metastasize, in general they will not be removed.